mean, one of the things I think that is fantastic is that things like the MRC Centre exist. You know, that the Medical Research Council believe that mental health is an area where they want to invest money. You know, we talked earlier about this fantastic new building. You know, the fact that university are putting up, for this great building to do this work says something about the priorities that have been given. The fact that in Wales, the Welsh Government through NISCA gave the mental health, the Biomedical Research Centre in Wales that became the National Centre for Mental Health. You know, it was mental health research that was picked out as being, you know, where the Welsh Government wanted to focus attention and focus money. I think these are really positive, positive things, because in some respects they give traction to this belief that these illnesses are not mysterious and unsolvable, that this is the best that we can do, that's all that we can do is palliative care, is be nice to people and look after them, and but actually that by scientific means, that understanding more about the causes of these conditions, that we can make real advances that will lead to better treatments, that will lead to better ways of identifying people who are unwell, that will lead to better diagnosis, that will lead to diagnostic systems that are more rational, you know, that things will be better in 10 years, in 20 years, in 30 years' time because of research that's done now. And, you know, and that, I think, is the strong belief that many of us in the centre have, and that what underpins the work that we're doing, you know. And I don't think that belief is shared by everybody, actually, you know. I think there is this belief that that mental health is so complex, is so different to the rest of medicine, that, you know, that research isn't going to, pay benefits, isn't going to bring fruit. And, you know, I think what I would say is I strongly going to refute that approach, and think that the only way that we're going to make things better for people in, generations to come is to do the kind of research that we're doing here now. Yeah, I think hope is a really important thing, actually. And actually the most important thing you can do often as a doctor, not just as a psychiatrist, is to say to somebody, I can see how much distress you're in, I can see how it feels hopeless to you at the moment, but actually you will get better. And actually sometimes you have to be very positive and instill hope where you might not be feeling too hopeful yourself. And I think that's a really important role, because actually that in some ways that's against this. In some ways that's quite a paternalistic thing to do. It's and it goes against kind of sharing and all of the complexity and the uncertainty and the difficulties and but sometimes the most important thing you can do is just be a clinical person in that scenario, not just a doctor who says, look, I've seen people in a place you are in at the moment, and I've seen people come through and get better, and that things aren't hopeless. And that's a really important message. And I suppose that message of hope is important in that is those individual clinical relationships you have with people, and I suppose in the engagement work we do as a centre with the public, it's on that bigger scale. The message is, look, these things aren't impossible to understand. They're incredibly complicated. It's incredibly difficult. All of these factors play a role in a very complex way. But actually, we are slowly making progress. There is hope. There is hope that we are going to make advances that will really help people in years to come.